Good afternoon, everyone. Good afternoon, sir. We are the Group 9. We will present the Chapter 9 entitled Types, Characteristics, and Identifications of Learners with Difficulty Walking and Moving. In these chapters, it describes the various types of conditions which result to learners having difficulty walking and moving. It focuses on physical disabilities, neurological disorders, and other health impairments. It covers how these conditions affect learners, and suggested accommodation and classroom adaptations are also provided. Gross motor developmental milestones are also discussed, which could aid functional screening for these conditions. Lastly, a checklist that can be used by teachers in identifying learners with difficulty moving and walking is given, and formal ways in which these conditions are screened and diagnosed are described. In these chapters, it describes the different conditions which result the learners having a difficulty walking and moving that you need to know as a future educator in order for you to understand your student and how you treated them. It also focuses on physical differences, disorders, and health impairments. And you may know also how these conditions affects your learners and how you accommodate this factor and how will you do in order to adapt these conditions. Intended learning outcome distinguish the different types, identifications, etiologies, assessments, and characteristics of learners with difficulty walking and moving. Next is learners with difficulty walking and moving. The language that we're using describing learners could reflect and shape the way we think about using. For instance, let us look at the difference between child with and the disabled child has by disability. The disabled circumstances on child that other when including hand, we say disabled. Child's attitude with child disability, good and resources implies rather this child than that is people's one's physical and what disability to use instead. Uh, According to Facts 200, it shows in this part, it talks about the language that we're using was also be part on how the learners will reflect and shape the way we think. Next table is table 9.1 shows handicapping and what to use instead. There are two separated in this table. Try to avoid and use instead. If you want to say handicapping child, use disabled child. Instead, you may said suffer from the victim of said has the condition, has the impairment. If you will say confined to a wheelchair bound, use wheelchair user. Instead, you say mentally handcuffed, learning disabled, you may use learning difficulty. Crippled, disabled child. Spastic, has cerebral palsy. In this table presented, how words do we need to use and avoid if we were talking these types of learners. Next is, in this chapter, we will discuss learners with difficulty walking and moving, which include learners with physical disability, neuromotor impairments, or other health impairments. Physical disability is a label given to a vast range of difficulties to do with physical functioning. It is a continuum wherein one end includes children with minor motor problems, and at the other hand are children with very little control over their physical functioning, according to Facts 2003. Next slide. Physical disability or orthopedic impairment could be caused by congenital anomaly, including clubfoot impairments caused by disease such as bone, tuberculosis, and impairments from other causes such as cerebral palsy, amputations, and fractures or burns, according to Howard 2017. According to Howard 2017, the reason why there are physical disability and orthopedic impairments is because of disease such as bone, tuberculosis, and impairments, the cerebral palsy, amputations, and fractures or burns. Physical difficulties turn into a disability if it is prevents a person, thus disabling one from participating in society in general and in school in particular. For example, difficulties in doing the following could indicate that one is physically disabled: moving around school, moving within the classroom, positioning within a lesson, accessing the curriculum in terms of hand, according to Facts 2002. You may assist or know if the physical difficulties into a disability in the learners. Other health impairments refers to conditions of having limited strength, vitality, or alertness, which could limit others' participations in education. For example, when has heightened alertness toward environmental stimuli, it could limit one's alertness when it comes to the educational environment. This could be a chronic, example is long-lasting and most often permanent condition that could result to special education. Condition of limited duration but nevertheless could produce severe symptoms. It means these health impairments can limit the child or learners to well participating in the class because of these conditions. There are other health problems. Example are asthma, attention deficit disorder or ADD, or deficit hyperactivity disorder, ADHD, diabetes, epilepsy, heart condition, among others, which negatively affects one's school performance. Neuromotor impairments rather involve central nervous system, which affects one's ability to move, use, feel, or control central body parts. Example is cerebral palsy that we will discuss soon after this other slides. Next slides. Typical and atypical development of gross motor physical skills. Gross motor physical skills are those which require whole body movement, involve the large muscles of the body, and are used to perform everyday functions: standing, walking, running, and sitting, and many more. Upright as well as eye-hand coordination for us to be able to tell whether a child's gross motor functions are developing. It is important to take note of the gross motor development milestone died below, which provide a functional screening of developmental skills per age. Kidsons. Failure to display the given function at the expected time could problems in which mobility could be affected, and wherein difficulty walking and moving could be experienced. When we say developmental milestones are behaviors or physical skills seen in infants and children as they grow and develop. In this table, we will see how normally the infants or a person develop according by age, and the other side, if they not meet the expectation, what possible implications. If they are not meet the developmental milestones of a child or the learners. First is age developmental milestone, possible implication if milestones not achieved. 0 to 6 months. Normally, it is rolls over front to back and back, sits with support, and then immediately. If the milestone or the developmental milestone cannot achieve or meet, this is the possible implications they had for muscle development, for locomotion, delay ability to play independently. 6 to 12 months. Crawls forward on belly, assumes a seated positions, enable grips on hands and knees. Possible implications of milestone not achieved. Develop delay in 6 to 12 months. The normally developmental milestones is close forward on belly, assume seated position unaided, grips on hands and knees. 6 to 12 months can close forward on belly, assumes a seated positions unaided, grips on hands and knees. Not achieved, delayed sensory developmental due to increased ability to explore environment for muscle development. In 6 to 12 months, she or he can, the baby do, is he can or she able to sit alone without support, get first tooth, place peekaboo, pull set to standing, and others. Next is okay. 6 to 12 months, the developmental milestone or the expectation they had is close forward on belly, assumes a seated position unaided, grips on hands and knees, and others like walks while holding onto furniture, takes 2 to 3 steps without support, rolls a ball in limitation of an adult, while the if the milestones is not achieved, it delays sensory development due to decreased ability to explore the environment. For muscle development, delay play skills. Okay, in 18 months, 18 months, the baby or the child can sit, crawls, walk, sit as white, gait but walking, playing, running is less clumsy, pushes against a ball, and many more. While other delay if the milestone cannot achieve, it delay play skills, difficulty interacting with the environment due to delay ability to mobilize effectively. Poor muscle development. Next is 2 years old, walks smoothly and turns corners that we will see on our children in our house, like that. In our neighbors, they can begin running, is able to pull or carry a toy while walking, like that. While other, as the milestones cannot achieve, poor muscle development for running and jumping, delay ability to play independently and interact with the environment because um, of the decrease of ability they had. The next is 3 years old, initiates standing on one foot, imitates simple bilateral movement interaction of limbs. Examples, altogether for poor development of body. Poor development of body. Next is 3 years. Next is 3 years old. Imitates standing on one foot. They imitates other imitates the simple bilateral movement interaction of limbs, climbs jungle gym and ladders, pedals a tricycle or a bicycle, walks up, down stairs alternating feet, jumps in place with 2 feet together, and able to walk on tiptoes, and many more that we will see on the child in our house, like that. Difficulties or lack of confidence. One, if the milestone is not next is if the milestones cannot achieve in a 3 years old, decrease opportunities for social interaction, for development of body awareness and movement, planning difficulties, and difficulties using playground. Next, difficulties or lack of confidence interacting with other children. So it may have a limit at first, even they are growing. 4 years old. Next is stands on foot for up to 5 seconds. Like in a 3 years old, it develops increase. So kicks ball forward, throws a ball over arm, catches a ball that has been bounced, runs around obstacles, and other is if the impairments cannot achieve, lack of confidence in movement-based activity, difficulties using playground movement, difficulties or lack of confidence in interacting again with other children. Next, and I think it is second to the last, 5 years old, able to walk upstairs while holding an object, walks backward to heel, jumps forwards 10 times without falling, skip forwards after demonstration, and many more. And the other side is may result in poor self-esteem. So as we see on 3 to 4 years old, they lack of confidence in socializing their playmates, difficulty participating in sport activities, difficulties playing with moving toys such as bikes and scooters. While if 6 years old, the last is 6 years old, runs lightly on toes, able to walk on a balance beam, able to skip using skipping rope, and many more. Next is difficulty participating in sport activities, like in 5 years old that we tackled may result in poor self-esteem when comparing self to peers, like 3 to 4, 5. That is the developmental that we were talking, we socializing our playmates, our family, but because of the milestone cannot achieve, it difficult to participate in this type of socializing. May result in poor self-esteem when comparing self to peers, lack of confidence in movement-based activities. Next is types and causes of health impairments, physical disabilities, and neurological conditions.
Types and causes of health impairments, physical disabilities, and neurological conditions. The following are the common types and causes of health impairments, physical disabilities, and neurological conditions. Howard 2017. Epilepsy. Epilepsy or seizure disorder occurs when abnormal electrical discharges in the brain cause a disturbance of movement, sensation, behavior, or consciousness. There are many possible causes for epilepsy. These include cerebral palsy, infections of the brain, or central nervous system. Metabolic disorders, lesion due to scar tissue from a head injury, high fever, interruption in blood supply to the brain, shaken baby syndrome, among others. Among the conditions that can trigger seizures are fatigue, excitement, anger, surprise, hyperventilation, hormonal changes, withdrawal from alcohol or drugs, and exposure to certain patterns of light, sound, or touch. Epilepsy can occur at any stage in life. It most common co-developed during childhood. Okay, so when we say epilepsy is a disorder of the brain, any age can have it. Ang sintomas nito ay hindi makontrol na panginginig ng katawan at may sintomas pa na walang epekto. Sa labas na anyo ng isang nakararanas ng epilepsy ay ang panandaliang pagkabilisa at pagkakaroon ng matinding anxiety. Okay? There are different kinds of seizures. Generalized tonic-clonic seizures or grand. Seizures is the most common wherein muscles become stiff and one loses conscious and falls to the floor. It also involves violent shaking of the body while muscles contract and relax alternately. Absence seizure or petit mal is less severe. Occurs more frequently. It involves a brief loss of consciousness lasting from a seconds to half a minute or so. Okay. Seizures is a burst of uncontrolled electrical activity between brain cells, also called neurons or nerve cell. The attack causes temporary abnormalities in muscle, tone or movements, stiffness, twitching or limpness, behavior, sensations or states of awareness. Ang seizure ay maaaring dulot ng maraming sanhi. Kadalasang hindi posible na matukoy ang eksaktong sanhi ng isang seizure mula sa isang exam at kinakailangan ng karagdagang pagsusuri. Okay? One may stare blankly, flutter, or blink, grope or drop, whatever one is holding as if daydreaming or not listening. It is possible for one to be unaware of this seizure. Complex partial seizure or psychomotor seizure manifests as a brief period of inappropriate or purposely purposeless activity. For instance, smacking one's lips, walking about aimlessly, or shouting. Simple partial seizure involves jerking motion while consciousness is retained. One may experience an aura or a warning sensation before the seizures occur. Okay, so punta naman tayo dito sa asthma. So, asthma is a chronic lung disease. Its symptoms include wheezing, coughing, and difficulty breathing. An asthma attack is usually caused by allergens, such as pollen or certain foods, irritants such as cigarette, smoke, exercise, emotional stress. During asthma attack, the airways in the lungs narrow and the resistance in the airflow in and out of the lungs increases. Okay, asthma is a disease affecting the lungs. Ang mga sintomas nito ay paninikip ng dibdib at maingay na paghinga. Ayan, kasi kadalasan nakukuha natin tong asthma sa sa mga populasyon sa maduming paligid. Yung mga alikabok na, yan, mga ganyan. Okay? So, punta naman tayo dito sa cerebral palsy. Cerebral palsy is a disorder of movement and posture. It is a permanent condition that results from having a lesion in the brain or abnormality in brain growth. Diseases that affect the developing brain can result to cerebral palsy. Among the symptoms of cerebral palsy are disturbances in voluntary motor functions such as paralysis, extreme weaknesses, and lack of coordination. Involuntary convulsions and other motor disorders, an individual who has cerebral palsy may lose control over one's arms, legs, or speech. Okay, so cerebral palsy is the most common motor disability in childhood. Cerebral means having to do with the brain, while palsy means weakness or problems with the using the muscles. Yan, kapag sinabi nating cerebral, ito ay sa intellectual. Intellectual. While naman sa palsy, ito naman ay ang uncontrolled body. Yan. Ano nga ba yung sanhi ng cerebral palsy? Ang sanhi ng cerebral palsy ay pinsala sa mga parte ng utak na nagkokontrol sa pagkilos, balanse at postures. Yan. So, yan. Dito naman tayo sa types ng cerebral palsy. Okay, meron ditong monoplegia, hemiplegia, diplegia, and quadriplegia. Yan, alamin natin kung ano nga ba yung monoplegia. Yan, monoplegia ito ay isang uri ng paralysis na nakaka-affect quadriplegia. Yan, alamin natin kung ano nga ba yung monoplegia. Yan, monoplegia ito ay isang uri ng paralysis na nakaka-apekto sa paa, kadalasan sa braso. Minsan, maaari itong maging isang pansamantalang kondisyon, can also be caused by an injury or trauma to the brain, spinal cord, or affected limb. Next, hemiplegia. Ang hemiplegia ay isang kondisyon na sanhi ng pinsala sa utak o pinsala sa spinal cord na humahantong sa paralysis sa isang bahagi ng katawan. Nagdudulot ito ng panghihina, mga problema sa pagkontrol ng kalamnan at paninigas ng kalamnan. Next naman, dito naman tayo sa diplegia. Paralysis of the corresponding parts on both sides of the body. Last, dito sa quadriplegia, refers to the paralysis from the neck down, including the trunk, legs, and arms. Ayan. Depending on the location and extent of the brain damage, muscle tone and movement in different body parts may be affected. The following terms are used to describe the location of the limb involvement. Monoplegia, only one limb is affected. Hemiplegia, two lines MBS on same side on the body are involved. Triplegia, three limbs are affected. Quadriplegia, all four limbs are involved, and movement of the trunk may also be impaired. Paraplegia, only legs are impaired. Diplegia, primarily involve the legs, with less surface involvement of the arms, and double hemiplegia primarily involve the arms with less severe involvement of the legs. Okay, so dito naman tayo sa spina bifida. Spina bifida is the most common neutral tooth defect, which refer to congenital malformations of the brain, spinal cord, or vertebrae. Here, the vertebrae do not enclose the spinal cord. Thus, a portion of the spinal cord and nerve controlling the muscle and feeling in the lower parts of the body fails to develop normally. Ayan, so, ang spina bifida is a condition that affects the spine and is usually apparent at birth. Ang sanhi nito ay kakulangan sa folic acid sa dieta ng ina. Next naman sa muscular dystrophy. Muscular dystrophy is a group of inherited diseases marked by progressive atrophy or wasting away of the body's muscle. The most common and served type of which is the Duchenne muscular dystrophy, which affect only boys, although about 1/3 of the cases are due to genetic mutation in families that have no history of the disease. Among its symptoms are muscular weakness, which manifests in difficulty running or climbing stairs, walking in unusual with protruding stomach and hollow back, and having a cup muscle that appears unusually large because of fatty tissues replacing the degenerated mom. And so, muscular dystrophy are a group of muscle diseases caused by mutations in a person's genes. Yan. So, yan, dito naman tayo sa main areas of muscles weakness in different types of dystrophy. Okay, so, dito tayo sa Duchenne and Becker types. Okay. Are two related conditions that primarily affect skeletal muscles, which are used for movement and heart muscle. Almost these forms of muscular dystrophy occur almost exclusively in males. Okay, next. Emery Dufus. Muscular dystrophy is a condition that primarily affects muscles used for movement, skeletal muscles, and the heart cardiac muscle. Okay, next, limb girdle type is caused by mutations in CAPN3 gene. Type 2A is the most common form of limb girdle muscular dystrophy, accounting for about 30% of cases. Next naman, dito sa fasciocapuluhumeral type. Okay, is a rare genetic muscle disease that affects the muscles of your child's face, shoulders, upper arms, and lower legs. Last, oculopharyngeal type is a rare genetic condition. It causes weakness in the muscles around the upper eyelids and part of the throat called the pharynx. Okay, so ito naman tayo sa spinal cord injuries. They are usually caused by lesions due to a penetrating injury, stretching of the vertebral column, fracture of the vertebrae, or compression of the spinal cord. Among the common cause of spinal cord injuries are motor vehicle accidents, falls, acts of violence, and sports. Students who have spinal cord injuries usually need the use of wheelchair for mobility. Motorized wheelchairs are best for those who quadriplegia, while self-propelled train are suggested for those who paraplegia. Okay, so what is spinal cord injuries? The spinal cord injury is damage to any part of the spinal cord or nerves at the end of the spinal canal. Ang mga causes nito ay trauma tulad ng car accident, gunshot or disease tulad ng polio at spinal bifida. Okay, classification of physical disabilities. Physical disabilities that could limit a person's ability to walk and move could include physiological, functional, and/or mobility impairments. These can be categorized according to whether they are fluctuating or intermittent, chronic, progressive or stable, visible or invisible. In terms of pain experience, some involve extreme pain, some less, while some do not involve pain at all. The table below provides examples of classification of physical disabilities. Okay, so ang physical disabilities, ito ang physical na kondisyon na nakaaapekto sa physical na kapasidad. Kasama na rin dito ang brain or spinal cord injuries. Next naman, dito naman tayo sa Table 9.3 Classification of Physical Disabilities. Okay, example of progressive condition that get worse over time but can fluctuate. Multiple sclerosis, neurological deterioration, muscular dystrophy, muscular disorder, chronic arthritis, inflammation of the joints. Yan, alamin natin kung ano nga ba yung multiple sclerosis. Yan, so multiple sclerosis is characterized by disseminated patches of demyelination in the brain and spinal cord. Ang mga symptoms nito ay weakness, spasticity, urinary dysfunction, and mild cognitive symptoms. Next naman, ang neurological deterioration can be defined as a disease of two or more points on Glasgow scale. Next naman, alamin natin kung ano nga ba yung muscular dystrophy. Muscular dystrophy is a group of diseases that cause progressive weakness and loss of muscle mass. Next naman, ang muscular disorder. Muscular disorder are the diseases of and disorders that affect the human muscle system, and their main manifestation is skeletal muscle weakness. Yan, ang mga symptoms ng muscle disease ay muscular weakness, loss of muscular control, numbness, twitching, muscle pain, and certain types of limb pain. Next naman, alamin natin kung ano nga ba yung chronic arthritis. Chronic arthritis is a chronic progressive and disabling autoimmune disease. It causes inflammation, swelling, and pain in and around the joints and can affect other body organs. Yan, inflammation of the joints. Inflammations of the joints when the immune system or damaged tissue releases chemicals that cause swelling and other symptoms in a joint. Yan, example of non-progressive condition that remain stable. Cerebral palsy, neurological condition, spina bifida, congenital malformation of the spinal cord injury, neurological damage resulting from trauma. Example of disabilities that are non-progressive but can fluctuate. Fib- Fibromyalgia, chronic pain conditions, chronic fatigue syndrome, chronic fatigue condition. Theology of mobility impairment. There are many types of mobility impairment that limit an individual's ability to walk and move around, and the causes of which vary. Some of these conditions are present at birth, while some are due to illness or physical injury. In terms of severity, mobility impairment could range from limitations in stamina to paralysis. Some mobility impairments are due to spinal cord injury, depending on which area is damaged. Okay, so etiology of mobility impairments range in severity from limitations on stamina to paralysis. Some mobility impairments are caused by conditions present at birth, while others are the result of illness or physical injury. Okay. Learners with quadriplegia have loss of function in their arms, legs, and trunk, and often need the use of motorized wheelchairs. Learners with paraplegia, on the other hand, have loss of function in their lower extremities and lower trunk. These learners could use manual wheelchair and could fully move their arms and hands. Ayan. So, dito sa students with quadriplegia have limited or no use of their arms and hands and often use motorized wheelchair. The wheelchair is one of the most commonly used assistive devices to promote injuries resulting in quadriplegia or paraplegia.